Post-Traumatic Stress Disorder by Amanda Coombs. A description of post-traumatic stress disorder. PTSD is a mental disorder that may develop after exposure to exceptionally threatening or horrifying events. They can relive events with flashbacks or nightmares. PTSD can occur after a single traumatic event or from prolonged exposure to trauma, such as sexual abuse in childhood. About 3% of the adult population has PTSD at one time. Symptoms include persistent, intrusive recollections, avoidance of stimuli related to the trauma, negative alterations in cognitions and mood, and hyperarousal. PTSD affects about 3.5% of the U.S. population, approximately 8 million Americans in a given year. About 7 or 8 out of every 100 people will have PTSD at some point in their lives. So that comes down to 1 in 13 people will develop PTSD sometime in their lifetime. Some contributing factors of social determinants of health could be workplace safety, physical environment, racial segregation, early childhood experiences, crime rates, exposure to violence, gender, and exposure to traumatic events such as natural disasters or unwanted sexual contact. Here are two pictures, one a graph and the other that talks about reasons or what can cause us to have PTSD. So top 4 reasons for men would be rape, combat exposure, childhood neglect, and childhood physical abuse, whereas women, the top 4 would be rape, sexual molestation, physical attack, or being threatened with a weapon. On the graph, it shows us causes of PTSD. There could be physical assault, sexual assault or rape, sudden death or to a loved one, transportation, illness or injury, weapon assaults, severe suffering, accidents, or any natural disasters that can cause PTSD. Some contributing factors for Maslow's hierarchy of needs. Safety first. We say these words almost every day, but we all take this for granted for what Maslow proposed in his famous theory of hierarchy of needs. Safety needs come second to physiological needs. Safety needs are personal security, financial security, and health and well-being, which are more fundamental than physiological needs. Safety, worrying is the major reason for mental disorders, such as anxiety, phobia, depression, and PTSDs. Some likely health problems that PTS can cause is anxiety, depression, or memory problems. PTSD can lead to self-destructive behaviors, and these behaviors can lead to substance abuse, which could lead to infections by needles or other ways of having substances. These behaviors could also lead to having sexual intercourse with unknown people, which could lead to STIs. First of its kind study finds people with PTSD were 1.8 times as likely to have any infection as those without PTSD, ranging from being 1.3 times as likely to have meningitis, to 1.7 times as likely to have influenza, to 2.7 times as likely to have viral hepatitis. A new study is the first to examine the relationship between post-traumatic stress disorder and dozens of infection types in a nationwide cohort. Researchers found that PTSD affects infection risks for men and women differently, having, for example, more of an effect on a woman's risk of urinary tract infection and a man's risk of skin infections. Some self-care that you can do when you have PTSD is to learn a little bit more about just what PTSD is, whether it be going to a support group, finding flyers, talking to people that you love and trust, looking up on the internet. We can also help with our PTSD by avoiding alcohol and drugs. making sure that we're talking to as many people as we can to make us feel better. Practice relaxation techniques such as meditation. Some things that we can do that are self-harming with PTSD. This can cause anxiety disorders, cardiovascular disease, negative alterations in our emotions and our mood. We could have reckless or self-destructive behavior, gastritis, respiratory disorders, unhealthy diet, eating habits. People with PTSD are 3 to 5 times more likely to have a depressive disorder, and experience a traumatic event can increase a person's suicide risk. Dr. Matthew Toll stated, "It's important to know that the anger of people with PTSD can become so intense that it feels out of control. When that happens, you may become aggressive towards others or even harm yourself. That doesn't always happen, however, and not everyone with PTSD lashes out angrily. Keep in mind that anger is only one symptom of PTSD. In fact, it's not a requirement for receiving a PTSD diagnosis. Although it can be, it's not always violent either. More often than not, someone with PTSD who tends to feel extreme anger tries to push it down or hide it from others. This can lead to self-destructive behavior." So when that happens, some people turn their anger on themselves in the form of self-destructive behaviors. This may include substance abuse or deliberate self-harm. And these are the references for the slides. Thank you.